Understanding prostate cancer. If you've been diagnosed with prostate cancer, you may feel shocked, upset, or scared. Maybe you feel overwhelmed by the decisions you need to make. Prostate cancer, its treatments, and their side effects can change your life. One of the ways you can help yourself is to learn about the disease. Prostate cancer is the most commonly diagnosed cancer among men in Canada. 1 in 9 Canadian men will be diagnosed with prostate cancer in their lifetime. When you receive your diagnosis, you'll be introduced to a team of healthcare professionals who will support you, including your urologist, nurse, and possibly a medical oncologist or radiation oncologist. You and your healthcare team will talk about your diagnosis and the different kinds of treatments. Your doctors may recommend some options, but only you can choose the treatments that are best for you. So what is the prostate? It's part of the male reproductive system. It sits below the bladder and in front of the rectum. The prostate and seminal vesicles make fluid that mixes with sperm from the testicles to form semen. Prostate cancer happens when normal cells in the prostate grow faster or die more slowly than usual. This leads to a cancerous tumor over time. It helps to know some of the words that your healthcare team will use so you can understand the disease. The grade of your tumor and stage of your disease are important to know and will help you and your team decide which treatment is best. The grade of the tumor refers to how abnormal the tumor cells look under a microscope when compared to normal cells. It tells your doctor how quickly the cancer may be growing and how likely it is to spread. The cancer stage describes how big the tumor is and whether the cancer has spread outside the prostate to other parts of the body. If the tumor is found only in the prostate, it is called localized prostate cancer. It may also be called early-stage disease. Locally advanced prostate cancer is when the cancer has spread outside the prostate to nearby areas of the body. Metastatic prostate cancer is cancer that has spread to lymph nodes or other parts of the body, such as the bones, liver, or lungs. It's important to know that most early-stage prostate cancer can be treated successfully. In some cases, the tumor will grow so slowly it can be monitored with active surveillance. With this type of treatment, your healthcare team watches the cancer closely. They will use tests and exams to check if the prostate cancer is progressing or your condition is getting worse. Other treatment is given when you develop symptoms or the cancer changes. Other types of treatment for prostate cancer include surgery, radiation therapy, hormone therapy, and chemotherapy. The treatment you and your healthcare team choose will depend on the stage of the cancer and your overall health. Some of these treatments may cause side effects that affect important parts of your life. That's why you need to think about what matters most to you when making decisions about treatments. At your next healthcare appointment, make sure you talk about what is important to you. Ask about how a treatment may affect your sex life or change how your body looks or functions from day to day. Find out what side effects would likely be permanent. Don't be afraid to ask your healthcare team for advice. It's also common to get a second opinion if you need help choosing the right treatment for you. Understanding your diagnosis and working with your healthcare team will help you take control of the decisions you need to make. To learn more about prostate cancer, visit cancer.ca.